Premature ejaculation is the most taboo topic within men's health. It's probably the one with the most shame and stigma attached to it. And yet it's one of the most common sexual health concerns, affecting up to 30% of men at some point in their life. Yet because of stigma, many never seek help or even talk about it, let alone understand what's going on. So we're going to demystify this one today and break down the causes and get practical about management, as well as look at natural and conventional support for it. Now, premature ejaculation is whenever a man ejaculates sooner than he or his partner would like during sex. And in severe cases, that can mean ejaculation within 1 minute of penetration. It's not just about timing, it's about lack of control. It's really frustrating. And if the impact your relationships, it can impact you as a husband, as a provider, as a sexual partner. It can really downplay your masculinity and your self-esteem. Now, there's two types of premature ejaculation. First and foremost, there's the primary, the lifelong. It's present from your very first sexual experience. And then there's the acquired premature ejaculation that develops later. And it's often linked to physical or psychological factors. Now, the causes are complex, and often there's a mix of factors. But ultimately, first and foremost, you've got biological. These are hormone imbalances like low serotonin, prostate issues, or inflammation of the urethra, or an infection. Even genetics can play a part in that. And then there's psychological. This is sexual performance anxiety or stress. It could be depression, relationship issues, guilt, or shame. There can be lifestyle issues such as a lack of sexual experience, infrequent sex, or poor physical health and sedentary habits. And then understanding your root cause is key to finding the right solution. So conventional management falls into three main categories. First and foremost is behavioral. So behavioral techniques to help is a start, stop, squeeze method. In essence, a little bit like hedging or masturbation, but without ejaculation. And then there's pelvic floor exercises to help strengthen control. There are medications that are offered as topical anesthetics like lidocaine to help reduce sensitivity. And then SSRIs or antidepressants such as sertraline or paroxetine, which can delay ejaculation as a side effect. The other way we can address this is cognitive behavioral therapy to help tackle anxiety or any underlying psychological factors. Now, alongside those three approaches, there's natural options that can help. Some herbs to consider for this is ashwagandha, Withania somnifera, which is helpful for reducing stress and for hormone balance. Mucuna pruriens is helpful because it helps support dopamine and stress reduction. And then passion flower, which helps reduce anxiety and promotes relaxation. Kava is really powerful for performance anxiety. It's restricted here in the UK, but it is available elsewhere. Just use with caution and according to the guidance on the bottle. St. John's wort is an SSRI if antidepressants are a no-go for you. And then you could look at your nutrition. So zinc-rich foods, and I would include pumpkin seeds or oysters here to support testosterone and sperm quality. And magnesium is really helpful for muscle control and for relaxation. Next up is physical activity. So improving your endurance with exercise, reducing your stress levels, supporting your overall health are definitely key to this. So Kegel exercises or pelvic floor exercises strengthen the muscles for a better ejaculatory control. And there's plenty of apps that you can look at to guide you through these. You could look at stress management, mindfulness, meditation to help reduce anxiety and to focus on enjoyment during intimacy rather than being afraid that you're going to ejaculate. Other practical techniques that are helpful: breathing, practice slow breaths during sex. So inhale for 4 and exhale for 8. That helps boost nitric oxide and it strengthens the erection and it delays ejaculation. Timing. So schedule sex whenever you're less stressed or in part of the day when you're more relaxed to help reduce pressure. Try masturbation before sex so that you're able to go longer with the partner, and consider some long-term strategies too. Premature ejaculation, all fun and joking aside, can really impact confidence and masculinity. And That is in part because men are really notoriously bad at confessing to this or talking about it. But more men, and I find especially younger men, are talking about this in clinic. And I'm encouraging people to get talking with their partners because it's an opportunity to deepen emotional and physical intimacy with each other. To share strategies can really help make a huge difference. So get comfortable being vulnerable. And remember, your masculinity isn't defined by how quickly you come or not. Try and get into brotherhood, group of friends who are supportive and help you feel accepted and less isolated. And I promise you that the moment you start sharing that, you will find other people in the group more willing to share their story, that they also struggle with this, because it's up to 30% of men can suffer with this in their lifetime. Now, bedroom strategies recap. I just want to kind of go over the start, stop, squeeze method, Kegel exercises. Do try the herbs, the ashwagandha, the nucleopurine, St. John's wort, kava kava, and you can consider the supplements, zinc and magnesium, particularly zinc for men. You want to try and communicate, if with your partner, but also with your mates, to make sure that you realize it's not uncommon and actually you don't need the stress or the anxiety that comes with this. And then one final thing I just want to talk about, and you can have a lot of fun with. This is called the lingam massage, and it's not about a hand job. It's a form of tantric massage connecting the heart, the head, the body, and the soul. And it brings a deeper connection and allows you to relieve your stress that is associated with the premature ejaculation, to enjoy the touch. And it is helpful, I find, for both premature ejaculation and erectile dysfunction. Now, if you want to learn more about that, you probably have to go onto my Men's Hub, where you can do a search on Google to find out more about the lingam massage. Ultimately, it's something that you and your partner can do to really enhance enjoyment and mood and remove the stigma of the ejaculation to it. The premature ejaculation is common, it is treatable, and it's nothing to be ashamed of. And with the right tools, the right behavior, medicine, both natural and pharmaceutical, and emotional support, it is possible for you to have a really enjoyable, satisfying sex life where you feel you are both being enjoyed and enjoying without having the anxiety of how quickly you're going to climax. Now, if this has helped open that door for you, then I would really encourage you to both like and subscribe to the channel, but also share this widely so that we actually get to talk about this taboo. Cheers.